Hello, good morning, everyone. My name is Syed Madruddin Taj, and I'm going to discuss the Unit 4. Going to discuss the Unit 4 with all of you today. And first, we will go through with the uh, brief of the Unit 4. And before I start that, uh, I want to let you all know that the recording is started, and I'll introduce myself as well. So, I have done my bachelor's in health and social care, plus I have done QTLS, PGCHE, and uh, assessor level 3 course, and level 4 of assessment as well, IQA, and I have been teaching for health and social care and business studies since 2007, and I have experience in both the care working and also teaching. So, and I have written 5 books, which all are available on uh, different online platforms. My books are available on uh, ebook format and also as um, paperback format as well. They all are available on Amazon, Google Play, and Apple Play. I don't remember actually all of the names of the platforms, but if you Google my name, Sayyid Mazaruddin Taj, then you will find my books and all the information about me. So first we will begin the unit specification with for the unit 4 working in health and social care, which is for ATHE level 3, and the first bit for this unit is uh, that is working in health and social care. So this unit is designed to equip you all with a comprehensive understanding of the essential um, aspects of providing safe, effective, and person-centered services with the health and social care sector. And over this course, like you will explore the fundamental principles that underpin the work of health and social care professionals, which include person-centered practice, safeguarding, communication, infection control, and the administration of medication. And please, in the meanwhile, if you do have any question, then please ask me, and I'll try my best to answer the question. So we'll discuss about the learning outcomes. For this unit, uh, there are 6 learning outcomes which we need to do, and learning outcome uh, are these. Like the first one is understand person-centered working. So in that, what we need to do is we need to define person-centered practice and analyze how it contributes to continuity of care. And then we have to describe the role of safeguarding and its benefits of positive risk taking within a person-centered approach. So in the first learning outcome, we have the task. Like in any assignment, we have a few things to consider. Like we have three grading criteria which we can achieve. We have pass, merit, and distinction. And before going on to that, uh, look here. Uh, like we have already discussed the unit aims. Now I'll tell you about like the unit level that is for level 3. Then this is the unit core, and GLH means guided learning hours. So the guided learning hours are 80 hours, and this unit has a credit value of 15. So that means we can say that one credit value is equals to 10 hours of studying. So it would be about 150 hours. So the grading structure is based on pass, merit, and distinction. So in order to pass any learning outcome, what we have to do is we need to pass in all of the aspects of the first learning outcome, second, third, whatever learning outcomes we have to cover, we have to achieve uh, all the pass criteria. So, for example, if we have to achieve a pass criteria in the learning outcome one, so we need to define person-centered practice. Then the 1.2 is analyze how person-centered way of working contribute to continuity of care.
Hello,
Then,
sir.
hello.
Yeah, sorry. It look as if the Zoom link for this class, most people did not get it or it's coming late because we're supposed to have been like 10 people minimum in this class, and it's only me in this class. That's my observation.
Oh,
And
yes,
everybody is always in attendance right from the when we started. So this is the first time that only one student will be in the class. So
right. No problem.
yes. Mm,
Thank you for letting me know. And like the recording is already started.
okay.
So if anyone has missed the starting bit of this like class today, so what they're gonna do is they can listen to the or watch the videos on YouTube and Moodle as well.
Okay.
So I was discussing, and again, if you have any more questions, then please do let me know, and I'll explain that bit. So I was telling about uh, the grading criteria. So in order to pass, like it's not only with this unit, whatever unit we'll study in any health and social care sector or any subjects. So these are the same principles for every assessment criteria, and like we need to cover everything in detail in order to get a pass. So for the first one, first learning outcome, we have to discuss about understand person-centered working. And in that, the first bit we need to cover 1.1 is define person-centered practice. Then the 1.2 is analyze how person-centered ways of working contribute to continuity of care. Then we have to describe the role of safeguarding and protection in person-centered practice. And in 1.4, we need to explain the benefits of positive risk taking for individual assessing services. So, look, we have um, six learning outcomes to cover in this unit. And for that, can say if we want to get a pass, then what we need to do is we need to complete all the tasks in the pass criteria 1.1, 1.2, 1.3, 1.4. Then, for example, we have the learning outcome 2. That this is understand the use of effective communication in health and social care provision. So in that, we need to mm, do describe the 2.1 criteria, which is describe the role of communication in health and social care. Then we have 2.2, which is explain methods of communication used in health and social care. Then we have to uh, do the work on the 2.3, which is identify barriers to communication in health and social care. Then we have 2.4, describe information handling and recording procedures. Then we have 2.5, explain the principles and practices relating to confidentiality in health health and social care. So on, we'll go forward with the all of the pass criteria, and we need to make sure that we don't miss any single bit from this grading criteria in order to get a pass. So it will go in a sequence, and we will finish at 6.4. So that means that we have 6 learning outcomes to cover in this unit, and each learning outcome has its subsections as well, like 1.1, 1.2, 1.3. So we need to cover those. So the last one is the 6.4, and there's a sequence every time when we have to when we plan to get a certain grading criteria. Like for example, if we want to get uh, uh, merit grade, so what we have to do, for example, for learning outcome 1, we need to cover the 1.1, 1.2, 1.3, 1.4. Then we have to go for the 1M1, and uh, by that we will go in a sequence: 1.1, 1.2, 1.3, 1.4, then we'll go for 1M1. It's not like the case that we will automatically do only the 1M1 and we think that we will get the merit grade. It's not correct. So we have to do the work in a sequence. And for example, if we are planning to achieve distinction, which I always encourage all of you to um, do the work as a distinction work. So that would be better. If you'll get a better grade, then that would be highlighted on your certificate. So that will give you a better chance of getting a good opportunity in your professional life and career. So what you need to do is you need to go for all the learning outcomes: 1.1, 1.2, 1.3, 1.4. Then you will go to 1M1, then you will work on the 1D1. So in this way, you will apply all the or work on all the criteria related with the pass, merit, and distinction. And after this 1D1, you will go for the 2.1 for the learning outcome 2. So in any assignment, if it's a sequence like this, for example, this one has 1.1, 1.2, 1.3, 1.4, then 1M1 and 1D1. Then you will go for 2.1, 2.2, 2.3, 2.4, 2.5. Then if there is any 2.6, let me check. No, so uh, after that we have 3, learning outcome 3. So after 2.5, you will work on the 2M1, and then you will work on the 2D1. This is the correct sequence how we will do the work for pass, merit, and distinction, or the all the criteria. So we'll start with every time whenever we do assignment, we'll start with the pass criteria. Then for any learning outcome, we'll go in a sequence. Sequence is the pass criteria like this. Then we'll go to merit. Then we'll work for the distinction, and then we'll go to the second learning outcome, which is this, and it will go like this, and then we'll go for merit and then distinction. And after we did the work for the 2D1, then we'll go for the uh, learning outcome 3, that is know how to reduce the spread of infection, and we will work with the grading criteria, learning outcome 3.1, 3.2, 3.3. Again, we'll go in a sequence like this, and then we'll go to 3M1, and then we will work on 3D1. And after that, we will work on the uh, learning outcome 4, which is understand working relationships in health and social care. So then we'll go for 4.1, 4.2, 4.3, 4.4, and then we'll go for 4M1. Now look at this case. In this scenario, what we don't have a distinction criteria here. So when we don't have any criteria in merit or distinction, so what we will do is we will uh, do all the criteria, all the work related with the passing criteria, then we'll go for the merit. And in this case, we don't have a distinction criteria in the learning outcome 4. So what we'll do is then we will go for the 5.1 and so on. We'll go till the 5.3. Then we'll do the merit criteria work, then the distinction criteria. Then we'll go for the criteria 6.1, then till 6.4. Here we have till 6.4, and look now in this learning outcome 6, we don't have a merit criteria here. So what we'll do is when we complete all the work related with the passing criteria, then we will go for the distinction criteria, which is 6D1. So this is the correct sequence how we do the work on our assignment. And so these are the indicative content which we will um, discuss during our lessons and what we'll cover in this complete unit. So here are 6 learning outcomes which we need to cover in this unit, which is unit 4, working in health and social care. So this is the brief overview about the unit which we are starting from today, and we will cover each learning outcome in a separate class. So is there any question from anyone? If anyone has a question about the brief of the unit 4, then they can ask me.
No question.
Okay, so we will begin the lesson. So we have right. So we have the PowerPoint for the unit 4, and today we are going to discuss about learning outcome 1, which is understand person-centered working. So as we begin this unit on understanding person-centered working, it's important to set the stage for what we will be exploring. And the concept of person-centered care is at the heart of everything we do in health and social care. It's about shifting our focus from the needs of the services or from the need of service to the needs of the individual. So this approach recognizes that each person we care for is unique with their own preferences, needs, and values, and it requires us to tailor our care to meet those specific needs. And throughout this unit, we will discuss into the key principles that make person-centered care possible, which include respect, dignity, and safeguarding. And we will explore how to apply these principles in practical ways that enhance the quality of care we provide. So, just for example, we can think about a time when we had to make a decision about our own care or well-being. So, how much better did we feel when our preferences were considered? So we all might have some examples about that, and we might have some thought about it when if we consider ourselves in this situation when we are um, like have a choice or we are dealing with our own person-centered care, and so this unit will equip you all with the knowledge and skills to deliver care that is not only effective but also compassionate and responsive to the unique needs of each individual. So, and as we move forward, you all need to keep in mind that our ultimate goal is to put the person at the center of everything we do. It's not only related with uh, the health and social care sector, so we need to do it in all of the professional aspects in our life. So this was about the first slide. Then we'll go for the aims of the unit. So, right, in this unit, what we have to do is we have to do the understanding of key features in health and social care. And the goal of this unit is to help you understand the essential elements that make up effective and safe service delivery in health and social care, which will include principles like person-centered care, safeguarding, and building effective working relationships. So, just for example, working in a care home where the needs of each residents are different, and we need to understand key features like person-centered care ensures that each resident's unique needs are met, contributing to their overall well-being. Then we have person-centered practice, and person-centered practice is central to this unit, and it involves focusing care on the individual rather than the system. And we need to ensure that services are tailored to meet the specific needs and preferences of each person. So, for example, in hospital setting, person-centered practice might mean adjusting visiting hours to suit the preference of a patient's family and allowing for more support and comfort during their stay. And if we talk about safeguarding and protection, so safeguarding is about protecting individuals, particularly vulnerable ones, from abuse, harm, or neglect. And it is a critical aspect of providing care and is um, related with the person-centered practice. So, as an example, we can say that if a caregiver notices signs of neglect in a child's appearance, such as consistent hunger or uncleanliness, so safeguarding protocols would require them to report this to the appropriate authorities to ensure the child's safety. Then we have effective working relationships and communication. So, in this, we build a strong working relationship, and effective communication is vital in health and social care. It ensures that the care is consistent, coordinated, and meets the needs of the individual. So, for example, we can say that good communication between a nurse, doctor, and family member can prevent misunderstanding about a service user or patient's treatment plan, and ensuring that everyone is on the same page and the patient's care is uninterrupted. And again, in the meanwhile, if you have any question, please do ask. Right. So In this slide, uh, we have to discuss about person-centered care. So we need to focus on the individual, and person-centered care places the individual's need and like their preferences, and like we we don't go for the needs of the service, we'll go for the individual person. And this approach ensures that care is tailored to the specific preferences, needs, and values of each person. Has anyone of you followed the person-centered care approach at your workplace? You have any example of person-centered care? We always follow the person-centered care approach at our workplace related with the health and social care. So if you are working in this sector, you might have any experience of any example, then you can share. If no, then I'll provide you an example. So, as an example, we can say that a patient recovering from surgery may prefer to have physical therapy sessions at home rather than at the GP service or at the hospital. So, a person-centered approach would arrange for a therapist to visit the patient or the service user at home, and making their recovery more comfortable and personalized. So this is related with the person-centered care. This one is again related with the person-centered care. Here they are giving us some examples from these images. Right. Here we need to discuss about professionalism, personalization, relationship-centered care. Right. So uh, in this one, we can say that personalization refers to creating care plans that are tailored to an individual unique needs and preferences, and it moves away from a generic approach to one that involves the person in the design of their care. Um, as an example, we can say for someone living with a long-term condition, personalization might mean developing a care plan that includes specific dietary requirements, preferred activities, and a schedule that fits their daily routine. Has anyone had any example or any experience of like a tailored person-centered care approach for a specific service user at your workplace? And what is like working at your workplace? Like, uh, do you follow the person-centered care approach at your place of work? I think someone is talking, but their mic is mute. So then we'll discuss about relationship-centered care, and This concept extends personalization by focusing on the relationship that are important to the individual, uh, such as those with family, friends, and caregivers. It ensures these relationships are considered and supported in the care process. Um, for example, in a care home, relationship-centered care might involve encouraging regular visits from family members and facilitating video calls if they cannot visit in person. So it helps the resident stay connected with their loved ones. So this is all about personalization and relationship-centered care. Okay, here we need to discuss about the importance of person-centered values when working on health and social care. So, look here, they have mentioned that there are eight person-centered values that support person-centered care and support. So, we need to go through with them individually. So, there are eight person-centered values in which could include respect, dignity, individuality, privacy, choice, right, independence, and partnership. So these values guide the provision of care that respect the unique needs and preference of each individual. Um, when we are caring for someone with a disability, we need to respect their independence. It means allowing them to participate in tasks they can manage rather than doing everything for them. So, thereby preserving their dignity and sense of self-worth. Any other example from any student while they're working at their workplace? Right. Here we need to discuss about respect. So, for respect, um, we can say that it involves supporting an individual in what they believe is important, regardless of their age, culture, disability, gender, beliefs, or sexual orientation. So, for example, if a patient observes dietary restriction based on religious beliefs, showing respect would involve ensuring that meals provided adhere to these restrictions. Um, for example, if we have a Muslim um, service user or patient at our place of work. So if they ask for halal meat, then we need to provide them the halal meat. We cannot give them the other meals. We only need to give them halal meat, so they'll go for the vegetarian option or fish. But we need to consider about other allergies. If they are allergic to fish or nuts, then we need to uh, give the food which is suitable for the service user, and then we need to include the individual in the conversation as well. um, we need to always include the individual in conversations about their care, and we need to ensure that they are not ignored or spoken about as if they are not present. So, for example, we can say that during a care meeting, even if the individual cannot speak for themselves, they should be acknowledged and involved as much as possible, perhaps through non-verbal cues or by asking for their preferences as well. And we need to avoid assumptions on terms of endearment. So we never assume it is acceptable to use terms of endearment like dear or love without first checking how the person prefers to be addressed. So, for example, we can say that some people may appreciate being called sweetie, while others may find it patronizing. So, always ask first to ensure that you are addressing them in a way that they feel comfortable with. Right. So, now we will discuss about dignity. And if you have any question, if you have any question, please do ask. So, when we talk about dignity, so it means respect and importance. So, dignity is about feeling respected and valued in society and within one life. It's important in all aspect of care, whether someone is eating, sleeping, or receiving personal care. So, as an example, we can say when assisting someone with personal hygiene, using a towel to cover parts of their body that are not being washed help maintain their dignity. And we need to listen and take our time. So we don't need to um, rush people and take time to listen to their concern. So this approach help preserve their dignity and makes them feel valued. For example, if a service user is struggling to express their needs, taking the time to listen patiently rather than hurrying through the conversation so that you value their input and respect their dignity. And we also need to avoid stereotypes. So it's important not to stereotype or make assumptions about individual based on their appearance, condition, or background. So, as an example, we can say that assuming that an older person is hard of hearing without first asking them can be disrespectful. So, what we need to do is we need to always approach each person without preconceived notions. Okay. Now, here we have to discuss about individuality. So, support we need to support individual choices, and we can say that every person is unique, and care should reflect their individual choices, respecting their dignity and personal beliefs. For example, if a resident in a care home prefers to spend their mornings in the garden rather than participating in indoor activities, their choice should be supported and accommodated in their care plan. And we have to tailor care for the individual. Care and support should be tailored to meet each person's specific needs, showing respect for their individuality. Uh, Example is a care plan for someone with diabetes might include a specific diet, exercise routine, and medication schedule that suits their lifestyle rather than a generic plan used for all diabetic patients. So we'll always look for the individual and the person-centered care. Then we have privacy. So for privacy, we can say uh, individuals should have time and space to do things in private, such as talking to family and friends or making personal phone calls. So, for example, we need to ensure that service user has access to private area where they can speak to their family on the phone without being overheard. It is an important aspect of respecting their privacy. And we can call doors must be closed, like so. We can say close doors during personal care, and we need to ensure that doors are closed when personal care is being provided. And for example, before assisting a resident with dressing, closing the door to their room ensures that privacy is maintained and they feel more comfortable. And they are also telling us that we need to knock before entering. So always knock on the doors before entering a room, respecting the individual person's space and privacy. As an example, knocking on a service user's door before entering their room in a care facility, it demonstrates respect for their privacy and gives them a sense of control over their environment. Right. Here we have to discuss about choice. So we have support informed choices, and individuals should be supported to make informed choices about their care and daily activities. They should be provided with the necessary information to make these choices confidently. And have anyone experienced it? Is there any personal experience or example while you're working at your workplace? I'll give you example. So uh, we can say that if a service user is choosing between two treatment options, providing them with detailed information about the benefits and risk of each allows them to make an informed decision that aligns with their preferences. And then we have to acknowledge and respect their choices. So acknowledge the individual choice, even if they differ from what you might choose. So we need to respect their autonomy, and it's a key aspect of person-centered care. Example is if a service user decides to forego a certain medical procedure in favor of we can say alternative therapies. So it's important to respect their decision while ensuring they understand the potential outcome. And let me clear that we are not talking about the life-saving treatment. If a person of us or a service user or patient is has to go a life-saving surgery, then we cannot um, go for any alternative and complementary therapy treatment. So, but we will discuss everything with the service user, patient, or then we will decide. And we cannot go for an alternative way of therapy for any life-saving treatment. In certain cases, we cannot go for the alternative therapies way, but in some cases, we can go for a um, alternative or complementary way of treatment. Now, we will discuss about involving individual in decision making. So we always need to involve the person in decisions about their care and support, ensuring they have a say in what happens to them. So, for example, when planning a care routine, we need to ask the individual what times of the day they prefer to receive care, such as morning or evening, and incorporate their preferences into the schedule. Then we have we have to simplify choices when necessary. So some people may find it overwhelming to be presented with too many options. So in such case, it might be better to simplify the choices to make decision making easier. So as an example, we can say um, instead of offering a wide range of meal options, um, we might present two or three choices that meet the dietary needs and preferences, and helping the person decide more easily. And, again, any question, so please do ask. Here we have to discuss about rights and particularly the Human Rights Act 1998. So we have a right to say no. So we can say that every individual has the right to refuse a treatment or care option. So this right must be respected, and if the decision goes against medical advice, um, we will go for the uh, Human Right Act 1998. So, as an example, we can say if a service user or a patient refuses a particular medication, they have the right to do so, and it's the caregiver's responsibility to ensure they understand the implications and document the refusal appropriately. So it's a must for as a caregiver that we discuss everything with the service user, and there is a right to have a relationship. So individuals have the right to form and maintain relationships, including romantic relationship, and these should be supported as part of their care. So we can say, as an example, in a care home, supporting a resident's relationship might involve helping them arrange regular visit with their partner or providing a private space where they can spend time together. And we have we have right to participate in care decision. So we already discussed it, like individuals have the right to be involved in decision about how they are supported, including how they live their lives, what they eat, and how they spend their time. And we need to balancing rights with responsibilities. So while respecting an individual right, it's also important to consider the responsibilities of the caregiver and the potential risk involved. Um, as an example, if a service user decision to refuse treatment puts them at significant risk, caregiver must balance respecting their decision with the duty to protect their health, and we need to involve senior staff or legal advisors if necessary. Right. Here, to discuss about independence. So, independence involves supporting individuals to do the things for themselves as much as possible, rather than doing everything for them. And this helps them feel in control of their lives and increases their self-worth. Um, for example, a service user um, like we can encourage a service user to take part in their own grooming, such as brushing their teeth or brushing their hair, And even if it takes longer, and we need to promote independence and confidence, then we have to take time to enable independence, and we need to allow time for the individual to do things on their own, and providing support only when necessary. So this helps them develop skills and maintain independence. Um, as an example, we can say that instead of feeding a service user who is capable of feeding themselves, we need to provide the tools and encouragement. They need to eat on their own, and even if it takes more time. Right. Here we have to discuss about partnership. So for partnership, we can say that mm, partnership in care involves working together with other professionals, and it includes colleagues and families to provide comprehensive and person-centered care. It ensures that everyone involved in the care, and like they communicate effectively, and we need to work towards the individual best interest. Mm, For example, we can say that in managing a chronic illness like diabetes, so we can say partnership might involve regular meeting between the healthcare provider, dietitian, and family members to ensure that the service users' diet, exercise, and medication all are coordinated and effective. Then we have good communication, and so effective communication is the key to successful partnership. Sharing appropriate information and maintaining clear, open lines of communication, it helps to ensure that everyone is aligned and working towards the same goals. As an example, we can say that in a care home, regular staff meetings where updates on each resident health and preferences are discussed. It ensures that all staff members are informed and can provide consistent, coordinated care. How often do you have those care meetings at the workplace? If any one of you working in a care home, how often there are meetings related with the residents? Mhm. Yeah. So here we need to analyze how person-centered ways of working contribute to continuity of care. Okay. So first we'll go for the definition of continuity of care. So continuity of care, it means providing consistent, coordinated care that avoids disruptions and ensures that the individual care needs are met smoothly across different care settings and over time. As an example, for a patient or service user transitioning from hospital to home care, and continuity of care would involve a detailed handover between hospital staff and the home care team, and ensuring that the service user treatment plan is followed without interruption. Then we have role of person-centered care. So, person centered care supports continuity of care by involving the individual, their family, and all care providers in the care planning process. ensuring that everyone is informed and that care is delivered consistently according to the individual need and preferences. So, as an example, if a patient requires physical therapy after surgery, a person-centered approach would involve coordinating with the hospital, the therapist, and the service user family to ensure that therapy sessions continue smoothly after discharge. Then we have right, we have um, importance of communication and participation. So what we need to do is we can say that effective communication and active participation by all stakeholders are crucial for maintaining continuity of care, and it ensures that everyone is aware of the care plan and can contribute to its successful implementation. So as an example, we can say regular updates between the healthcare provider, service user, or patient and family can prevent misunderstanding and ensure that the care plan is followed and reducing the risk of errors in the care of the service user. Right. It's related with the previous slide. So, uh, service user about change. Right. So we can say that this one, like person-centered care, is a fundamental standard in health and social care, meaning that is a basic expectation that all care should be focused on the individual, not just their condition. Um, so they have given us some examples as well. Um, like, for example, before discharge by healthcare practitioners, social care team is well away to take over the change and provide residential care to the discharged patients. Mhm. And we have thing important happiness. Mhm. Also, we would go for the respect for individual values and priorities. So, this approach respects the person's view on what is best for them and takes into account their values and priorities in life. And it ensures that care is not just clinically effective, but also personally meaningful. For example, if a patient values maintaining their independence, even at the cost of a slower recovery, their care plan might prioritize rehabilitation activities that allows them to live independently as much as possible. Then, right, we have an example of person-centered care, and here they have given us an example. So we'll explain this case. So, uh, so here we have an example of person-centered care by describing the case of Malcolm, a 27-year-old inpatient who was involved in a car accident and needed care during his recovery. So this example demonstrates how care is tailored to Malcolm's preferences, involving him in decisions about his care. So Malcolm prefers to have his girlfriend assist him with his personal hygiene routine in the evening rather than the hospital staff in the morning. So this request is accommodated, showing respect for Malcolm's personal relationship and preferences, which enhances his comfort and sense of control during his hospital stay. And we have flexibility in care planning. So the nurse in the example shows flexibility in adjusting the standard care routine to better meet Malcolm's need and preferences. This is a key aspect of person-centered care, where the standard procedures are adapted to suit the individual rather than forcing the individual to fit into a rigid routine. So uh, here they have allowed Mal Malcolm to listen to audiobooks provided by his girlfriend rather than just watching TV as part of his daily routine. So it's an example of adopting care to his preferences, which contributes to his emotional well-being. Right. Here we have why person-centered care is important. So it's important because person-centered care helps individuals feel more comfortable and confident in the care they receive, and by upholding their dignity and independence. Mutual respect is built, which enhances trust and the overall care experience. Uh, as an example, we can say that a service user who feels respected and heard by their healthcare provider is more likely to adhere to their treatment plan and communicate openly about their needs, leading to better health outcomes. Then we have uh, uh, we have to meet emotional, social, and practical needs. So in that we can say beyond medical care, person-centered care ensures that an individual emotional, social, and practical needs are met, contributing to a higher quality of life. As an example, a person living in a care home, this might involve arranging regular visits from friends or organizing activities that align with their interests and that allows them to stay engaged and fulfilled. Then we have support for non-communicative individual. So person-centered care is particularly important for individuals who may have difficulty communicating their needs, such as those with dementia or learning disabilities. Caregivers must find suitable ways to understand and meet these individual needs. Uh, for example, a service user with dementia who struggles to express themselves verbally. A caregiver might use non-verbal cues like observing body language to understand their needs and preferences. And last one is promoting independence. So, encouraging independence through person-centered care help individuals feel more in control of their lives, which boosts their confidence and involvement in their own care. So, as an example, allowing service user to participate in small daily tasks like dressing themselves even if they need some assistance. So fosters independence and self-esteem. These are the important points. Right. Here we need to discuss about role of safeguarding and protection in person-centered practice. So first we'll go with the definition of safeguarding. So safeguarding involves protecting individual basic human right and ensuring they live free from abuse, harm, or neglect. And it plays a critical role in person-centered practice by ensuring that every individual, like that we value, we see their values, preferences, and beliefs, and every individual um, like preferences, beliefs, and values are respected. So, as an example, we can say if a caregiver disregards a service user religious dietary restriction, so it could be considered a form of emotional abuse. So, safeguarding ensures that such preferences are respected. Then we have emotional abuse. So, when a service user's values and preferences are not respected, it can lead to emotional abuse, which is why safeguarding is essential in person-centered care. As an example, if a care provider routinely ignores a service user request to participate in a certain cultural practice, this could be emotionally harmful to the service user. We need to respect their choices. So, safeguarding includes respecting an individual's choices, such as what they eat or what they get out of, or when they get out of bed, and as failure to do so could lead to an abuse. And as an example, if a service user prefers to skip breakfast and eat later in the day, so respecting this choice is part of safeguarding their rights and promoting person-centered care. Then we have protecting from danger, and so safeguarding involves protecting individuals from danger, and it ensures timely medical care and maintaining privacy. It also includes actively involving them in decision-making processes, which is central to person-centered practice. As an example, ensuring that a service user receives their medication on time while also involving them in decision about their care plan exemplifies their integration of safeguarding with person-centered care. Here we have uh, given an example. A service user may share certain life secrets with care provider, so may belong to a minority group, might be getting government help because of lack of funds, etc. So, however, by providing care without disclosing such things to anyone, safeguard and protect their service user. So, we have all those important aspects related with the safeguarding, and duty of care can be said to have reasonably been met where an objective group of professionals considered, and we have the health profession council standards, so we always need to follow these. Right. um, okay. Here we have to discuss about safeguarding adults and why it matters. So safeguarding adults is about protecting their rights to live in safety, free from abuse and neglect, and it's a fundamental aspect of person-centered care, especially for vulnerable adults. Uh, as an example, in care home, safeguarding might involve ensuring that staff are trained to recognize signs of abuse, such as unexplained bruises, and know how to respond appropriately to protect the resident. Then we have local authority. So the CARE Act requires local authorities to take action if they believe an adult is at risk of abuse or neglect. This involves making inquiries and ensuring appropriate actions are taken to protect the individual. So, as an example, if a local authority receives a report that a resident in a care facility is being neglected, they are responsible for investigating the claim and taking steps to ensure the individual safety. Then uh, we have the safeguarding adult board explanation. Local authority safeguarding adult board. Right. So, um, local authorities are required to set up safeguarding adult boards to coordinate responses to safeguarding concerns and ensure that vulnerable adults are protected effectively. So, a safeguarding adult board might bring together representatives from healthcare, um, social services, and law enforcement to review a case where a vulnerable adult is at risk, and it ensures a coordinated response. Right. And here they have also mentioned about uh, we don't need to consider one size fit all care plan. So we always need to make sure that the care plan is according to the individual, and it should be based on person-centered care of that individual. Okay, so here we have principles of safeguarding. So first one is empowerment. And empowerment in safeguarding means helping vulnerable people and their families make informed decisions about how their safeguarding issues are handled. Then we have prevention. So, prevention is the primary goal of safeguarding, aiming to stop abuse or neglect from occurring in the first place. This can be achieved through good practices and policies. As an example, we can say that a care home might implement a policy of regular staff training on recognizing and preventing abuse to reduce the risk of harm to residents. Then we have proportionality. So, responses to safeguarding issues should be proportional to their level of risk involved, and ensuring that actions taken are appropriate and not overly intrusive. Then we have protection. So, those who need safeguarding protection should receive it, ensuring that they are safe from harm regardless of their vulnerability. Then we have partnership. So, safeguarding requires collaboration among various individuals and organizations working together to protect vulnerable adults effectively. Then we have accountability. So, transparency and accountability are critical in safeguarding, ensuring that everyone involved understand their responsibilities and the actions taken. So, as an example, a healthcare provider involved in a safeguarding case must document all actions taken and decisions made, providing clear records for review by all parties involved. Here we need to discuss about the benefits of positive risk taking. Okay, so we have individual assessing services, right? So we can say that positive risk taking can help build an individual confidence by allowing them to take control of their life and make decisions, even there is a degree of risk involved. So, as an example, we can say encouraging a service user or patient who has recently had surgery to start walking again, even with the risk of falling, that can help them regain their strength and confidence in their abilities. And then we have developing new skills. So, taking positive risks can lead to the development of new skills, enabling individuals to handle new challenges and grow in their abilities. Right. So, we can say that, as an example, a person with a learning disability might be encouraged to care for a pet, um, which helps them develop responsibility and a sense of accomplishment. Then we have right. We have from like we can say that positive risk taking also include learning from mistake, which is a natural part of personal growth and development. As an example, if a person with mental health challenges attempt a new task and fails, they can be guided to understand what went wrong and how to improve, which can lead to personal development. Then we have building self-esteem and independence. So positive risk-taking build self-esteem and fosters independence by allowing individual to take control of their decision and action. As an example, supporting someone to live independently after a period of hospitalization, even with the risk involved, can greatly enhance their sense of independence and self-worth. Then we have what is positive risk-taking. So, positive risk taking involve recognizing the risk in everyday life and supporting individuals to take calculated risk rather than avoiding them completely. And as an example, allowing an elderly person to continue gardening even if there is risk of falling with appropriate safety measures in place, it promotes their sense of purpose and enjoyment of life. So then we have uh, benefits. Okay. So the benefits of positive risk taking. So the benefits could include greater independence, opportunities for personal growth, and enhanced confidence and self-esteem. Example is encouraging someone to pursue a new hobby despite their initial challenges. It can lead to personal fulfillment and a stronger sense of self. And we have some examples. So, for example, like helping someone shave with their supervision rather than doing it for them, and even if there is a slight risk of cuts, supports their independence and self-care abilities. Mhm. I'm sorry, students, I'm taking long because this unit is this learning outcome is very long. It has about 44 slides, and I don't want to miss any slide. Um, then we have uh, to analyze how the 6 C's of care underpin person-centered practice. And in the meanwhile, if you have any question, please don't hesitate to ask the question, and I'll try my best to answer your questions. Uh, Now, here we have to discuss about the 6 C's. So, uh, right, the 6 C's of care are care, compassion, competence, communication, courage, and commitment are fundamental principles that underpin person-centered practice and ensuring that care is delivered with respect for the individual need and preferences. So, why are these important? So, these principles help protect vulnerable adults from mistreatment and improve their quality of life by ensuring that care is not only effective but also empathic and respectful. So, as an example, we can say commitment to high quality care might involve a caregiver staying late to ensure that a service user complex needs are fully met before handing over to the next shift. Uh, So here we have discussed about each three. So the first one is uh, care. So care represents the fundamental duty of all health and social care professionals. It's about delivering the best possible support to meet an individual need at every stage of their life. As an example, ensuring that a service user with mobility issues has the appropriate aid and support to move safely around their home is an example of providing comprehensive care. Then we have compassion. So, compassion is about intelligent kindness, treating people with empathy, understanding, and consideration, which enhances their care experiences. As an example, if a service user is struggling with a diagnosis, showing compassion might involve sitting with them, listening to their fears, and offering comfort without rushing them. Then we have competence. So, competence refers to the skills, knowledge, and abilities required to provide effective care. It includes understanding the needs of the individual and the best practices for meeting those needs. As an example, a healthcare provider demonstrating competence might keep up to date with the latest research on a specific condition to ensure they are providing the best possible care. And we can say that competence also involve ongoing learning and practice to maintain and enhance professional standards throughout one's career. So, as an example, attending regular training sessions on new healthcare technologies is part of maintaining competence in a rapidly evolving field. Then we have communication. So, uh, good communication is essential in health and social care. It involves adopting communication methods to suit different situations and individuals, ensuring that all information is clearly understood. As an example, using simple language or visual aids to explain a complex medical procedure to a service user or patient who has limited understanding, it ensures that they are fully informed and can make decisions about their care. Then we have per- person-centered communication example. So before making changes to a care plan, we need to discuss the option with the service user and explaining how each choice might affect them. It ensures that they feel involved and respected. Then we have courage, right? So courage in care means making difficult decisions, uh, advocating for excuse me, what's right, and speaking up when something is not being done correctly or fairly. Uh, Example is if a caregiver notices unsafe practices in a care facility, so having the courage to report these concerns, even if it's uncomfortable, is vital for ensuring the safety and well-being of all residents. Then, as we have in that, and courage also involves being willing to innovate and try new approaches to improve care, as well as advocating for the needs and rights of those in our care. So, as an example, a nurse might advocate for a patient right to a second medical opinion when the initial diagnosis is unclear or disputed. So, it ensures that the patient receives the best possible care. Then we have commitment. So, commitment involves dedicating oneself to providing the highest standard of care to each individual and continually seeking to improve care practices. As an example, we can say a committed caregiver might stay up to date with the latest best practices in care, regularly attending professional development courses to ensure they are providing the most effective and compassionate care possible. Like you all are uh, doing the courses and advancing in your studies, so it will also advance your career. And then we have, now we have Principles of Care Act 2014. So, the CARE Act 2014 encourages a person-centered approach to safeguarding vulnerable adults, ensuring that their well-being and needs are the focus of all care processes. When assessing a vulnerable adult need, a care provider might involve the individual and their family in the decision-making process to ensure that care plan reflects their preferences and circumstances. So we can take that as an example. Uh, So we have six principles of the CARE Act. Then, then we have involvement in safeguarding. So the Act emphasizes the importance of involving vulnerable adults and their nominated representative in safeguarding decisions, ensuring they are active participants in their care. So, as an example, if an elderly person is at risk of financial abuse, involving them and their trusted family members in decisions about protective measures ensure that their voices are heard and respected. Then we have empowerment. Right. So, the empowerment principle encourages supporting vulnerable adults in making their own decisions and providing informed consent regarding their care. As an example, a caregiver might explain the risk and benefits of a particular treatment to a patient or a service user in simple terms, allowing them to make informed decisions about whether to proceed. Then we have mhm, right? Then we have assessing needs for decision making. So caregivers should assess what support the individual need to make decision confidently and provide information in straightforward manner. Then we have questioning for clarity, and asking questions about the individual desired outcome ensures that the care plan is tailored to their goals and preferences. So, as an example, before proceeding with a treatment plan, asking the service user, what do you hope to achieve with this treatment? So, it helps ensure that the plan aligns with their expectation and needs. Then we have protection. So, supporting those in need. The protection principles involve supporting and respecting those who are most in need, ensuring they are safe from harm and abuse. As an example, a caregiver might work with social services to protect a vulnerable adult who is being financially exploited by a relative, and like uh, we need to ensure that appropriate legal and protective measures are taken. Then we have response to concern. So, caregiver must respond immediately to any concern about abuse or neglect. Uh, And as an example, we can say that if a caregiver suspect that a resident in a care home is being neglected, they must report it immediately to the appropriate authorities and take steps to ensure the resident's safety. Then we have prevention. So, prevention is about taking proactive steps to stop safeguarding issues from arising, which is crucial aspect of protecting vulnerable adults. Example is regularly viewing and updating care plans to address potential risks such as falls or medication error as a way to prevent harm before it occurs. Excuse me, I'm sorry. So then we have training for prevention. So, safeguarding training equips caregiver with the knowledge to recognize and prevent abuse, helping to protect vulnerable individuals. And as an example, a care facility might conduct regular training sessions on identifying signs of abuse, ensuring that all staff are vigilant and knowledgeable about prevention strategies. Then we have proportionality. So, it means that responses to safeguarding issues should be appropriate and not more intrusive than necessary. Also, ensuring that the individual dignity and quality of life are preserved. As an example, if a resident in a care home is displaying challenging behavior, a proportional response might involve a de escalating techniques rather than physical restraint, preserving their dignity while addressing the issue. Then we have involving individual in decision making. Mm, So, involving individual in decision ensure that safeguarding measures are proportional to their needs and preferences. So, as an example, before implementing a safety measure, such as installing bed rails, discussing the decision with the resident to ensure they understand and agree with the intervention. So, it will help ensure a balanced approach. Then we have partnership. So, effective safeguarding requires collaboration with local services and communities to detect, prevent, and respond to abuse or neglect. For example, a care home might work closely with local healthcare providers and social services to develop a coordinated response plan for a resident who is at risk of abuse, ensuring that all aspects of their care are addressed. Then we have sharing information responsibility. So, safeguarding partnership involves sharing information appropriately to protect individuals while respecting their privacy and complying with data protection laws. As an example, if a vulnerable adult is being abused, sharing relevant information with law enforcement while protecting the individual personal details ensure that they receive help without unnecessary exposure. And we have accountability. So, accountability in safeguarding means being transparent about the actions taken to protect vulnerable individuals and ensuring that all professionals involved understand their roles and responsibilities. As an example, documenting every step taken in safeguarding case from initial reporting to the final resolution ensures that there is a clear record of action which can be reviewed and audited if necessary. Then uh, we have to inform the individual. So keeping the vulnerable person and their representative informed about decision and action taken is a crucial part of accountability. As an example, if a decision is made to move a vulnerable adult to a safer environment, keeping them and their family informed throughout their process help maintain trust and transparency. Now we have to analyze why it is important for health and social care workers to demonstrate person-centered values. Look here, in this slide is mentioned 1D1, so it is related with the distinction criteria. So demonstrating person-centered value help meet the individual emotional, social, and practical need, ensuring they maintain a high quality of life. As an example, a care worker who takes the time to understand a resident hobbies and interests and incorporate those in their daily routine is demonstrating person-centered values, which enhances the resident overall well-being. And by respecting and involving individual in their care, uh, worker build trust and make the care experience more comfortable and positive for the individual. As an example, a service user who feels listened to and respected is more likely to trust their healthcare provider, leading to better cooperation and outcomes in their care. Then, as we have right here, we need to discuss about why person-centered care is important for healthcare. Uh, so what it does, it promotes positive health behavior. So person-centered care encourages individuals to adopt positive health behavior, improving their ability to manage their own health and reducing their dependency on healthcare services. As an example, a person-centered approach might involve helping a service user or patient set realistic goal for exercise and nutrition, empowering them to take charge of their health and reduce the risk of complication from their condition. And it also improves the team morale. So when person-centered values are demonstrated, it creates a positive and supportive work environment, improving team morale and overall quality of care. So as an example, a care team that works collaboratively to meet the individual need of resident is likely to experience higher job satisfaction and deliver better care as each team member feels valued and supported. Right here, we have to discuss about the person-centered care and support plans. So, uh, we can say that there are unique needs and choices. So, each person care plan should be unique, reflecting their specific needs, choices, and goals. This ensures that care is tailored to the individual rather than following a generic uh, procedure or template. As an example, a care plan for a resident with mobility issues might include personalized exercises and specific dietary needs and social activities that match their interests, ensuring that all aspects of their care are individualized. And we have uh, we have involving the individual in care planning. So, involving the individual in creating their care plan ensures that the plan reflects what is important to them, making it more likely to succeed. As an example, if a patient values maintaining their independence, their care plan might focus on strategies to support this, such as home modification or assistive devices. Right. Here we need to discuss about differences between traditional and person-centered care. So, uh, traditional care planning follows a medical model, and we can say that it focuses on what the person cannot do and making decision with little input from the individual. Excuse me. For example, in traditional care, a professional might assess a patient or service user need and create a plan based solely on clinical observation without considering the patient personal goal or preferences. And then if we discuss about our person-centered care planning. So person-centered care planning, by contrast, involves the individual in every step of the process, focusing on their strength, goal, and potential for change. As an example, a person-centered care plan for someone with a physical disability might focus on what they can achieve with the right support, such as participating in community activities, rather than just listing their limitations. Right. And we have then orienting to the decision. So it's important to help individual orient themselves to decision they need to make, which may involve providing support to understand the context and consequences of their choices. And we can give an example. mm, as an example, we can say uh, for a service user or patient with dementia, this might involve explaining a decision multiple times in a calm and respectful manner, and using simple language and visual aids to help them grasp the information. Here we have a case study, practice example, the case of M. So we have a case study of M, a 67-year-old woman with substantial medical needs and a mental health condition. So this case explores the balance between respecting M's wishes and ensuring her safety. So we can see from this case, M was placed in a care home against her wishes due to health risks, but the Court of Protection ruled that her quality of life should take procedures over more preservation of life. This emphasizes the importance of considering the individual perspective in care decisions. Then we have balancing quality of life and safety. So this case also highlights the need of to balance the safety with quality of life, respecting the individual assessment of what makes meaningful in their life. And what we have here, they have given us the example as well. The court recognized that staying in a care home, despite being safer, did not contribute to her happiness or quality of life, leading to a reconsideration of her care arrangement. Excuse me. And then we have the references here. So these all are the references used throughout the presentation, and it provides like sources for further reading and study. Okay, so here we have the plenary. So you all are encouraged to refer to the e-books and journals available on the learning platform for further study and clarification on the topics covered. So they have given us some instructions that if you have any query, questions, kindly email learnerwork@ukversity.co.uk. Then for submission of assignment to be done on learnerwork@ukversity.co.uk. And assignment submission is after 2 weeks of completion of the unit and its delivery. So that means that when we cover all the 6 learning outcomes and the assignment discussion lesson as well, after that you will have 2 weeks to complete the delivery of your assignment. Right, so we have covered everything in this learning outcome. So as we wrap up this presentation, I want to emphasize the critical importance of what we have covered. So the concept we have discussed, person-centered care, safeguarding, positive risk-taking, and the 6 C's of care are not just theoretical ideas, they are the foundation of high-quality, compassionate care in the health and social care sector. So we discuss about the person-centered values, and they are at the heart of everything we do. Then we discuss about safeguarding and protection. And they are also key components of person-centered care, protecting individuals from harm while respecting their choices. Uh, and we also discuss about positive risk-taking. So, but in some cases, positive risk-taking is about empowering individuals to take control of their life, make their own decisions, and learn from their experiences. We also discuss about the 6 C's of care. So we discuss about care, compassion, competence, communication, courage, and commitment. We also discuss the collaboration and continuity. So no one person can deliver comprehensive care alone. It requires a team effort working together with other professionals. We also discuss empowerment and accountability. So empowering individuals to the involved in their care is crucial. It builds trust and ensures that they feel valued and respected. So we can say that the principles and practices we have discussed are not just guidelines, they are essential for delivering person centered care that truly improves the quality of life for those we support. By embracing those values and continuously striving to apply them in our work, we can make a real difference in the lives of the people we care for. And we need to remember at the core of person centered care is the belief that each person is unique, and our role as a caregiver is to respect, support, and empower them to live their lives to the fullest. So I hope you all understood today's lesson. And again, I'm sorry again for taking it so long. I know the lecture was supposed to be for an hour from 10 to 11 a.m. But there were so many sites. There were 44 sites to cover in this unit, and also we discuss about the assignment, the structure of the unit. So that took us so long. I'm sorry for that, and hope you all don't mind about it. I just wanted to share all the relevant information so that I don't miss any important points. And um, if you follow all those instructions, then it would be easier for you to get easily a distinction in your assignment. So we always aim for the distinction in the assignment, and we need to do again the work in the sequence: pass criteria, merit criteria, then the distinction criteria. Don't only work on the pass criteria, always go for the pass, merit, and distinction criteria. So that's all for today's lesson. And in the end, if anyone has any question,
Thank you.
welcome. Welcome, Jesse. So uh, then I'll stop the recording and finish today's session. Thank you once again. Bye, everyone. Take care. See you tomorrow. Bye.